Hello, folks. I'm Murray Mandryk, legislative columnist for the Regina Lear Post. You probably remember me from our election podcast, along with my friend Arthur White-Crummey, our legislative reporter. Well, we're doing something not necessarily different, but something that is an extension of our election podcasts. We are calling it Inside the Marble Palace, and there is a lot to talk about today and actually since we last talked. And we're going to begin today. We've both been listening in on the Premier's latest announcement, the second government announcement in a week on new restrictions related since Friday on new restrictions on COVID-19. And if I remember correctly, Cabinet Shuffle was 8 days ago. And at that time, they said they had no new measures contemplated. Well, apparently they have a whole lot of measures contemplated. Real quickly, let's just talk about the most recent ones that people might not be aware of that Premier Scott Moe announced today. Arthur, fire away.
Yeah, so today we got the full province-wide mandatory masking that everybody was wondering about. You'll, of course, be aware that they've been sort of stepping towards this very slowly. We had it in 3 cities, then we had it in every city of 5,000 and more, and now we have it province-wide. Still no real clear sense of how they're going to be enforcing that or whether they're going to be enforcing it, but it is there. It is mandatory. You have to wear a mask in all indoor public spaces.
Let's take these one step at a time, because I'm a bit curious, and people are, why it's been so incremental. And I guess one theory that I have is that he's really had to win even the basic stuff over. And I guess when you talk about fighting COVID-19, the most basic is the mask issue, the mandatory mask issue. Canada, I think, has been slower to adopt it than other parts of the world. Anyway, up to and including the United States, and we all know what disaster COVID has been there, but there has been this large-scale push to have masks. It wasn't something that our chief medical officers, including Dr. Shahab, was really pushing hard. Yes, they'll say they recommended it, etc., but there was never any thought of a mandatory mask order a month ago, 6 months ago, 3 months ago. When we were asking this very question, it was asked of Moe during the election repeatedly. It was asked during the leadership debate. It was asked during the leaders' debate, I should say, and during the election on October 14th. Why do you think, or why can you explain to the people why the government has struggled so much to get this one basic element in place? And I think the Premier did address it, suggesting that, hey, we've done more than other provinces. Is it a problem everywhere, Arthur, or are we that slow here? Or why is it taking us so long?
Yeah, I mean, well, he pointed out that no province-wide mandatory mask orders in Alberta and British Columbia. Further, the order in just to the east of us in Manitoba is fairly new, is fairly fresh. And you're right, Canada as a whole does seem to have been dragging its feet on this to a certain degree. I never found the initial recommendation as confusing as some people seem to have. I thought they were always clear that if you're unable to maintain physical distancing, then you should absolutely wear a mask. I never found that especially confusing, but they have been very slow in making it mandatory. And it's even questionable whether something truly is mandatory when there's little enforcement behind it. So
it's slow to adopt in certain areas of the province, and I think that's why it has been so incremental. First, Regina, Saskatoon, PA, then as of last Friday, every community over 5,000. And then it seems to me it was almost a oops, we're getting too much blowback on this because we weren't really anticipating the fact that people wander in and out of communities, particularly bedroom communities, particularly rural municipalities that aren't necessarily always defined as bedroom communities pretty quickly. So I personally think they just had a hard time managing not only the communication on it, but the policy itself, where they just weren't recognizing that they were just contradicting their own orders to prevent transmission. And I think you're right, though. I think there is that reckoning and that recognition right now that they had to go there. Do you take that as sort of the one big step forward in today's announcement by Premier Moe?
To me, in some ways, the strongest step, the one that's most likely to have some impact, while at the same time being in some ways the most invasive, is the limitations on private gatherings. They moved it down from 10 to 5. That's pretty restrictive in terms of what people can do in their own home, and in many ways, it's stricter than what we're seeing in a lot of businesses. I mean, you can meet with a small party of, I believe, 6 in a restaurant, but in your own home, you're limited to 5. Not a huge difference, but clearly pretty restrictive when you're talking about what people can do inside their own homes. But Dr. Shahab was very clear that that's where they're seeing a lot of transmission. There's a lot of cases where people are in close quarters within private residences, and that's where it's spreading. So that to me is one of the clearer things that they did today that may actually have some impact.
I'm sorry, I missed some of what you said over the sound of my 20-year-old daughter sobbing up in her room upstairs over this.
No more parties at Casa Murray Mandryk.
Yes, you know my 20-year-old daughter and how she is not going to like the idea of having to restrict any friends or having basically restricting her bubble to 5, because it just doesn't work when you're a certain age. I guess what they were trying to do, though, is stop families from gathering and transmitting. I don't really understand the logic, and maybe you can explain this one to me better. But according to Shahab, the real problem is transmission within the families. Okay, I don't know if there's all that much evidence of it, considering some of the super spreader events have occurred in bars, in bingo halls, in other places, certainly in restaurants. When we used to get the COVID alert orders, it was always over some large box store or something else. So I don't necessarily see it as having been confined to families. Certainly churches have been super spreader events. What is the government's reckoning here in terms of thinking that they can contain it in the home, but it's okay to have it in bingo halls, or to go out in bingo halls, to go out in bars and restaurants, where last week they obviously announced that they'd close the last drink hour to 10 o'clock and closing time to 11, I guess, to stop the spread. What is the thinking here that maybe some people just can't explain? And I don't know if I can. In terms of the logic that they're trying to express is a strategy that will work.
I think that the premier expressed in the starkest terms today why he and the government is more reticent to be heavy-handed with business than with private gatherings, and that's jobs. He was really forceful that he views this as a unnecessary trade-off between the economy and public health, that he's going to try to do both at once. We'll see if he can be successful, but he made the argument that if we have a second lockdown, we're going to again lose tens of thousands of jobs, and the 15,000 people who are still out of work on a net basis compared to the pre-pandemic employment numbers are going to be out of work for longer. And he raised the prospect of mental health challenges, of really destitute and troubled people having to live through a shattered economy. And that's an argument that we've seen in a lot of places, and it's a trade-off that the premier is going to try to put off as long as he can. He certainly acknowledged that there may have to be a lockdown sooner or later, but it seems like he wants to try everything he can before getting there.
That's an interesting argument. He's moved the goalposts in essence, and so is Dr. Shahab, because we were once told if cases get up to 60 or so a day, we'd have to make some measures. Well, they really didn't, or very minor ones along the way, a couple minor tweaks and adjustments that I can't offhand remember what they were at that particular point. Then all of a sudden, we're not getting just 100 cases a day, but we're getting 200 cases a day right now. And I heard Dr. Shahab say today that, well, the new bar might be 300, and so did the premier, I guess, basically saying that we're not quite near Manitoba yet. We still have time. We still have an opportunity to head this off if somehow people take more responsibility than they already have, and unfortunately take more responsibility than they already have when they were actually lockdowns and restrictions in place where you couldn't get your hair cut, where you couldn't go to a bar or a restaurant, or you couldn't go to a bingo hall. At one point, there was even limitations on whether you could or couldn't go to church, but they've kind of removed those pretty quickly early on in the process. I don't get that particular aspect and that particular bit of mixed messaging from the premier. I get we all have to take personal responsibility for our own behaviors, and we can't really depend on for everything that goes on. But my goodness, like, what are people supposed to get out of this messaging right now when you have this situation where you're basically told that once you
I find that this approach is actually fairly typical for this government. We often see them make little adjustments, little incremental steps, either in response to criticism or in response to changing circumstances, and they generally get somewhere fairly close to where the critics wanted them to get from the beginning, but on a much longer time frame than people might have hoped for. And ultimately, it ends with more confusion and, as you said, with more mixed messaging than if they just had have pulled the Band-Aid off all at once. Unfortunately, in this case, if things do continue to get worse, that long drawn-out process may mean more hospitalizations, more deaths, and more economic pain in the long run.
That's really fantastic, Arthur, because I think those are the three critical elements that you're talking about. At this particular point, I think maybe they're trying to keep everything open so the businesses can compete with Black Friday, the Christmas rush, as best as they possibly can. The problem being is it runs into the other two. What if we do have, and the trajectory that we're on right now suggests that we will have the same levels of deaths and cases in Manitoba. Perhaps not deaths, because specific to Manitoba, it's gotten into nursing homes and it's gotten into other areas where once it's there, it creates an incredibly difficult and tragic situation. But isn't it a bit of a political gamble for the premier to do it, as you say, just keep doing this incremental stuff as opposed to pulling off the Band-Aids all at once and basically saying, let's deal with it as best we possibly can now where we can? Like, if the next step becomes, well, I guess we have to lock down casinos and bingo halls and maybe churches after all, doesn't he just wind up offering the opposition a fair bit of fodder? And we're going to have opposition pretty soon because the session's set to reopen on November 30th.
Perhaps, but even if he gets somewhere close to the same point in the end, and even if it does end up being harsher that it may have needed to be with quick action, I think that there's a segment of the population that appreciates the priority that the premier does put on the economy and does put on their jobs. Obviously, it worked for him during the election campaign. Polls routinely showed him as having a massive advantage over the New Democrats on that issue, and preserving that brand and preserving that credibility on the economy to show Saskatchewan people that he's going to continue to put priority on their jobs may be a good gamble in the end, even if it doesn't work. We'll see. But I also just want to come back to one other thing that you said. And you talked about if this gets into long-term care, and of course we're not where Manitoba is, we're not where Quebec was, but it is starting to get into long-term care. We're now in a situation where we have 13 residents of long-term care, personal care, assisted living across the province who've tested positive. There's 10 outbreaks amongst all kinds of seniors' homes, so that's not just those three categories. It includes others. Could include staff, but clearly we're at a tenuous point right now in terms of the province's success in preserving the lives of vulnerable people, which ultimately we have done pretty well compared to other provinces. It's unclear how much longer that can continue with this kind of community transmission. And that's one other thing that they tried to respond to today by imposing stricter visitation rules on long-term care. But there's still staff. There's still staff moving around between the community and long-term care.
And that's an incredibly important point, because if this exercise that we're engaging in right now is about the inner workings of the marble palace, you've touched on a few points that people need to think about as to why things happen in the way they do. And one of the reasons is that it's just not a political calculation on Scott Moe's part or the Sask party's part, that they prioritize the economy and jobs and everything else above everything else. They believe this into their heart and soul, to their very core, that this is more important. And sometimes, and this is difficult for others to believe, they actually prioritize this as something that's as significant or more significant than maybe health concerns that are being raised by others. Now, that gets into a very difficult thing. If we get trapped in a situation that you've described, where all of a sudden we are the worst, that we are as bad as Manitoba, that we are as bad as Quebec was, as you put it. At this particular point, though, I think what you touched on is absolutely critical. People tend to be satisfied as long as we are not the worst, as long as there's worse numbers in Manitoba. They had very low cases, but look what happened to them. And we're not quite as bad. We're taking steps to head that off, so we can get away with this incremental approach right now and deal with it that way. This is what's worked for us in the election campaign, and we're going to ride this as long as we possibly can. Until we don't anymore, and then we're going to finally move on those final incremental steps. So I think people, if they think about it in those terms, are going to have a better understanding as to why the Premier is moving in the direction that it does. What does that do for the opposition right now? And we are back in the same situation. The election's over. It's all about them holding the government to account again, even with a small 13-member caucus that they had before. Has the government today, do you think, provided the opposition with an ample supply of fodder, particularly where they are, or is the opposition getting into a bit of dangerous territory by basically not being able to put forward a good argument that what the Premier is doing is wrong? It's very easy for the Sask party and Scott Moe to say, well, you're just against the economy and you guys want to hold lockdown. Do you think that's what we're going to hear during the session?
It depends on how bad the cases are, but we haven't really heard Ryan Miley speak in those terms yet. He hasn't come out to commit to a full lockdown. He hasn't said that's what the NDP is calling for in precisely those terms. He's called for more clarity. He's called for more transparency, which would be great because we're not all of the numbers that the province is making these decisions on the basis of. They've been withholding modeling data, and Ryan Miley has hit them very hard about that. But he has never given a clear statement about what he thinks in terms of a lockdown or fairly broad-based business restrictions, saying that he needs to see that data before he can make that decision. Today, in response to the new announcement, predictably, he criticized the government quite hard, but it was mostly on the lack of clarity that you spoke about early on today. He was taking very much the same position, that there was a inconsistency and lack of clarity that is constant and disruptive. So that seems to be their line of argument right now. We'll see if things get worse, whether they're willing to be a little bit more forceful and a little bit more clear on what they would do differently once they get into the legislature.
That's going to be an interesting thought. I guess we need to wrap it up. Any final thoughts in terms of what the session is going to be like? Or is it going to be all, as Trump said, COVID, COVID, COVID?
Yeah, this is going to be the COVID session. I mean, both sides are saying that that's what they want to make it about, and it's going to be pretty hard to get away from it because the reminders are going to be constant. All of the MLAs we learned are going to be behind plexiglass shields, and they're going to be wearing masks. So it's going to be a pretty unusual legislative session, to say the least. And I don't think that we're going to be able to get away from the pandemic for 1 minute.
Well, yeah, it's going to be interesting. Thanks again for this time. I guess we'll talk pretty soon, probably before the session again. Thanks for joining us on Inside the Marble Palace. Even though we're really not inside the Marble Palace, we're still pretty much locked up in our homes.
COVID. We are told to work at home whenever possible. That was one of the recommendations today. So we are following the public health guidelines to a T.
and keeping within our cohorts and family groups. Take care, Arthur.
Thanks so much, Murray. Bye-bye.